I've been introduced. Whilst no expert, I am passionate about technology-enabled care and support and how telecare can help to transform people's lives and empower them, people to live more independently for longer in the community. So I am, for my sins, the telecare lead for ADASS at present, as well as being Strategic Director for People, which covers children's services, adult services and public health for the city of Wolverhampton. I'd just like to start by saying that I'm truly honoured to be here. Not least, though, sadly, I'm here for Harold Bodmer, who was president of ADASS, and tragically, he was a wonderful colleague. We lost him. He died in the summer. So he would have been here today. I know it was in his calendar, and I know he was looking forward to it because he and I discussed it. But I'll do my level best to do justice to his memory. I've led 3 transforming adult social care programmes as a director over the last 13, 14 years. All of them have been underpinned by telecare, as well as being connected with very much a housing rooted approach as well, because in my particularly long-standing role as a director, in fact 2 of them, I was responsible for housing. So David's points about how integral housing is to care and support is a point very well made. I ought to perhaps just start by saying what ADASS is. There are 3 objectives for the organisation, the Association of Directors of Adult Social Services. Something about social policy and plans reflecting the shape of our economic and social environment. So that is quite pertinent in the context of David's words about imagining the future. It's about being current, reflecting and shaping the future. And obviously, it's also about promoting high standards of adult social care services and also furthering the interests of those in need of care and support. So those are 3 aims of our charity. I think I was originally given a title for this, which was, "Are we connecting the right social care services in the community to get more integrated working?" And I thought about this, and I thought it sort of sounded a bit like service land. So I thought I'd talk a bit instead, really, about our vision, ADASS's vision for people in our communities. And that's very much about an asset-based approach, moving from a deficit, needs-based approach where people talk about diseases, even worse, comorbidities, which we hear with NHS colleagues, moving away from just mainly focusing on needs and disabilities, and, as I say, service land, and talking and focusing much more on what people can do, their strengths, much more an asset-based approach, how their communities can support them to live longer or forever within their own homes. How we focus on those strengths, how we help to support people to self-care, to manage long-term conditions when they have them, to focus on people's individual talents and abilities rather than that sort of deficit model. And we do, across systems, I think, create a huge amount of dependency. So that, I think, is key in terms of shifting that balance and that approach. And we mustn't forget either, how could we, when we live amongst it daily, that most people these days have got higher expectations. They're not prepared to, and neither should they, just focus on or accept passively a traditional range of social care services. People say to us, "I want a life, not a service." And it's our duty, I think, to meet that challenge. So it is all about home first. I never like the term, do you, out of hospital. NHS colleagues often use out of hospital. I think it's community care first, home first, self-care, enabling people to truly be in control. Moving away from care packages, I don't like that term either, even though I know we often use it, to support planning alongside people. So that's the vision and the journey that we're on, I think. Moving across the system to that strength-based approach, connecting support around the individual and enabling people to lead a good life and one they want to lead. Everyone's aware of the demographics, I think, but just as David cautioned us to reflect, having left my 90-year-old mother this morning, I hesitate to add, at home not feeling very, very well, David's example also made us think in a live way about impacts on people's lives, and the stats don't always do that. But the context is, as you can see here, very much about us managing unerring increased demand and trying to manage that demand across the health and social care system, hence the important emphasis of trying to better integrate health and care support, voluntary community sector support around individuals within communities. So the challenge is about trying to find new approaches which don't create dependency, that empower people and help people to keep control and be as independent as possible. 31%. This is the context, 31% reduction in adult social care budgets in the past 5 years. 1 in 6 people over age of 80 affected by dementia, and so on. You can see the rest. So the challenge is huge. We do an ADASS budget survey every year. Paul will remember that. And we feed that into the Treasury in each year in the annual spending round or budget planning round. And you can see from this that the gross budget last year was 19.6 million, this year 19.7 million, a tiny increase. Significant overspends equating to nearly 170 million last year, and this year, as I say, a tiny increase, 1.2% on the net budget. To maintain last year's level of service would have required more than 1.1 billion more because of demographic challenges, but also national living wage, of course, and also deprivation of liberty, safeguards, duties and different thresholds with the new legal judgments. So we've had an increase of about 170 million. That's all to meet increased demand. We did, of course, have the precept, which disproportionately adversely affected areas of higher levels of deprivation, but that only brought in about 380 million. So nowhere, a drop in the ocean, I suppose, but I mean, but nevertheless, obviously, we're grateful for that. Councils do continue to try and protect spend on older people and people with disabilities, despite reductions in central grant. And there are many examples of that, where other services have been cut in order to protect adult social care, reserves have been used, etc. Because adult social care counts for about 35% of total council spend, so it's very, very significant proportion. So 3% increase in the older population, but no increase in numbers of older people actually receiving services is the current context, with at least 39% of this year's savings coming from reducing personal budgets of people who receive care and support and cutting services. This year's savings, 941 million. Which is about 8% of the net budget and 29% of total council savings. And unfortunately, the survey did show that directors' confidence in delivering these savings is reducing, with much lower confidence levels emerging. So we have the national living wage. That was about 600 million it cost us. Most of us increased fees to providers, importantly, 82% of us, and 25% by more than 5% to take account of pressures. Many providers are facing financial difficulties now. We may well hear more from that, about that from Bridget. Better Care Fund is an important way of having different conversations and doing new pieces of work and innovation together. But the additional monies don't kick in until the end of Parliament, so that's a struggle. So in a nutshell, transformation is absolutely essential for survival of the system. There's more here in relation to the budget survey, and I'm sure you'll see the slides later. But the tipping point comment was cited from David Bean earlier. But we're spending less and less on prevention, and that's a problem. it's understandable as to why that happens, but spending more on prevention, including technology-enabled care and support, has to be one of the keys to finding a way forward for the future. A bit about, I was just going to say something about valuing our workforce. More people work in adult social care every day than in the NHS, and they make a positive difference every minute of every day, and that's something as a director I seek to ensure that I never forget. All that bit is a bit depressing, isn't it? Sorry. So what can we do? David spoke about leadership, and this is a huge leadership challenge, a connected leadership challenge across the whole system. What are we doing? The two most important routes for savings identified by all directors in the budget survey were increased prevention and working hard towards seeking to integrate social care and health around individual needs. There are lots of background documents helping us with this, including some fantastic work by the King's Fund. The key messages are about one size doesn't fit all. This isn't just about structural care models in terms of organisational form, but things like accountable care organisations are things we're looking at how they might be able to help us to transform services, not because restructure transform services, but if we're working in an integrated way, new forms might emerge. And some of this work is drawing on some international experience, importantly too. There have been a lot of criticism, a lot of adverse publicity about STPs, but they are enabling us to have some different conversations about whole system leadership. Most STPs are working on these sorts of areas, on managing demand at their heart, efficiency, and most have some work streams relating to those locally determined priorities. Across the Black Country, ours include mental health and learning disability as priorities, and maternity and infant health. But at the heart is all about improving patient, user, citizen outcomes. So that's one vehicle to help in the change process. There was a fantastic survey undertaken back by the Institute of Engineering and Technology. How tech savvy are we, was the question. And it showed just how greater independence in later life can be facilitated by technology. And can create some key benefits. And these are some of the things that the public are saying about the potential impact of technology on our lives. So things like 66% felt that future technology and support help people to, I can't even read it properly, so help to support people living at home for longer. And there are other very interesting statistics there. So there are often a perception about concerns about technology, but actually the public probably are way ahead of many of us. In prevention too, there are concerns also, the downside, that we seek to ensure that technology doesn't reduce everyday interaction and doesn't adversely affect community spirit. So there's that connectivity between individuals that we obviously need to be careful of. Sustainable workforce. Sustainability is a good word to describe our aspirations, I think. It can certainly be applied to workforce because our plans won't work without a well-trained, committed and ready to work workforce working with citizens to build on assets. And we need to understand the value of that sector. And at National Children's and Adult Services Conference in a fortnight, we're actually launching some work we've done within the City of Wolverhampton with Skills for Care on trying to quantify the contribution to the economy of adult social care, which we, through a very interesting Skills for Care formula, found contributes about £250 million locally to the local economy. Sustainable markets was the next thing I was going to talk about, but I think I'm probably running out of time rapidly if I haven't already run out of time. Shaping the market is a requirement of the Care Act, and we're working hard as commissioners to work collectively to shape our markets in partnership with our providers. And assistive technology has to be integral to that commissioning approach and to that work. The third strand is sustainable quality, which is all about ensuring that everything that we do builds upon improving our understanding of the experience of people. And finally, so I've tried to say a bit about sustainable people, places and communities as being the heart of our future vision. And it's all about how together we can actually create that sustainable future with a strong focus on technology-enabled care and support being absolutely integral to this. And I know that Stephen Tingle, the Director of Adult Services from Blackburn and Darwin, and Nathan Downing, Telecare Specialist, are talking later about some of the detail of how adult social care services in partnership with others are positioning technology at the heart of care and support. Thank you.